Vaccines have been called the greatest public health achievement of the past century, but they're actually a rather old idea. 1,000 years ago, physicians practiced variolation to fight smallpox. They crushed up scabs from smallpox victims and blew that powder into patients' noses. After a mild illness, these patients developed immunity. Centuries later, in 1798, English Dr. Edward Jenner deliberately infected healthy people with cowpox, producing smallpox immunity. The coming centuries brought rapid progress in vaccinology. 1877, germ theory of disease first proposed. 1930, cell culture practices allow for the production of viruses. 1979, smallpox is eradicated globally. 1988, World Health Assembly vows to eradicate polio. Globally, the number of polio cases decreases from 350,000 to just 187 in 2012. 2005, the CDC announces rubella is no longer endemic in the US, and the list goes on. But how effective are vaccines? Well, remember Edward Jenner, who infected people with cowpox? He's credited with saving over 530 million lives with his smallpox vaccine. The secret behind vaccinology is basic trickery. Vaccines contain a weakened bacterium or virus that mimics natural infection, triggering an immune response from the body. The immune system rapidly builds an army of cells designed to attack that specific infection, destroying the weakened invaders before they cause damage. A number of specialized immune system cells remain, called memory cells, that can quickly detect and destroy any later encounters with the disease. It's like target practice for your immune system. And with many vaccines, this immunity lasts for life. Yet for as long as vaccines have been fighting disease, there have been groups campaigning against the practice. During Edward Jenner's time, people actually believed using cowpox to inoculate against smallpox would turn patients into cows. More recently, groups have claimed that toxins found within vaccines cause autism. But many studies involving hundreds of thousands of children all strongly point out no correlation between vaccines and autism. And in 2009, the U.S. Court of Federal Claims ruled that thimerosal-containing vaccines do not cause autism. Despite all the evidence for the safety of vaccines, one survey found that 1 out of 4 parents have delayed at least one vaccine for their children. A dangerous effect of vaccine refusal is the return of diseases once thought eradicated. The CDC announced the eradication of measles in 2000, but in 2011, 220 Americans became infected, the largest number in 15 years. 2/3 of those infected had never received the measles vaccination. Currently, vaccine-preventable disease rates are at less than 1% of the pre-vaccine era in the US, but this could change if vaccine refusal spreads. Yet researchers are continuing their efforts to make the world a healthier place. They're working hard on developing vaccines for threats like HIV and malaria, cheaper vaccines that can be delivered to poorer areas, more effective vaccines with stronger and longer-lasting immune responses, and more efficient vaccine delivery systems. There are still many diseases out there waiting for us to let down our guard. Some are just a plane ride away. But with proper education and continued research, they can be beat. Because we're all in this together.
So, is the next pandemic really preventable?
Well, the ideal is that when you have outbreaks, that you detect them early and you contain them before they go global. Less than 2% of the deaths are in the first 100 days. Infectious disease is an exponential phenomena. And so if you let it run, then it's very difficult to rein it back in. The true exemplars, the variance between the death rates in countries with similar GDPs is quite dramatic. You have almost, a factor of 50 between the good performers and the poor performers, where sadly the US is in that poor performer category. And there's clear things that they did. If those were done early around the outbreak, then you could prevent it from spreading to lots and lots of countries. So that certainly should be the goal, is to not let it go global.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hey everybody, this is Dr. Michelle, and I want to welcome you to another segment of Tap Talks. And I have my guest with me, Emmanuel Ayanjoke. Hey, Emmanuel.
How you doing, Dr. Michelle?
Well, I guess I should call you Dr. Emmanuel because you're a doctor of pharmacy, and you're going to help us unpack what the heck is going on. Every time I turn on the news, we're learning and hearing about another infectious disease, many of which I thought the world had eradicated. So I got some questions because we're beginning to see the resurgence of these diseases that we thought we had effectively eliminated. Can you discuss why we're seeing a return of like diseases like smallpox, measles, and mumps? What's going on?
Yeah, so that's a great question. And it's something that we are seeing. Specifically the smallpox, for we're thankful to God that there actually isn't a resurgence. So for the smallpox per se, there isn't any more cases as far as the CDC reports. But measles and mumps, it's not been the same case. So actually last year, actually in 2019, there was about 1,274 cases versus 375 the previous year. So we've seen that, in the years when everyone is out, the resurgence of these diseases are coming back. A huge reason for that has most likely to do with routine vaccination rates. And because of COVID, there's been a lot of parents that haven't been taking their kids for their regular vaccinations because they've been, for the most part, indoors, staying at home. And, that makes sense because they don't want to risk taking their kids out there and getting exposed. So that also played a huge part into the amount of cases we're seeing. So, on one hand, they're trying to be safe, and on the other hand, kids are not getting vaccinated. They're not going to school in person as much as they used to, especially during the year of 2020. And you're seeing this is starting to sort of come back as we speak. A huge part of this thing too is also misinformation. There's been a lot of misinformation about vaccines and how vaccines work. So all of that has played into the resurgence of these diseases. One thing I'll emphasize though, the U.S. as a whole, there hasn't been a noticeable difference. However, there's a lot of variation on the state by state basis. So if you go down to states like Texas, there is a larger number of cases of these diseases that we thought would be that are coming back now.
So we're seeing actual regional differences. Okay, we know with COVID-19, there had been so much education out there about the efficacy of the actual vaccines, because for once, citizens had a choice. We had a choice between, at one point, 3 different vaccines. So we understood efficacy and what their protection rates are, but yet we still saw breakthrough infections and people were surprised. Can you tell us why people would have been surprised? Because I don't think there was a vaccine out there that was 100%, was there?
Yeah, that's a very, very big point to mention. I think, expectations is one thing. And in reality, there really isn't anything that's man-made that's 100%. Very few things are, or even get close to 90%. But however, I just want to emphasize that when people heard about that 95% protection from the vaccine, or 90% in the case of the Pfizer and Moderna vaccines, it wasn't referring to total protection from COVID. It was referring specifically to protection from severe illness, that is being hospitalized from COVID, or even death in many of those cases. So the goalpost of these vaccines is not to necessarily prevent infections per se, but to prevent severe infections and even death from COVID. And that's the most important thing. That's where the goalpost is. With that in mind, so far, even with the vaccination and the boosters and everything going on, we're still pretty close to that goalpost. So while people might freak out thinking that because there's more cases and people are getting infected, it's really because, number one, the virus has new mutations that are more virulent, so more people can easily get it. It doesn't mean that they're going to have severe cases. It doesn't mean they're going to be hospitalized from COVID. So that's a good thing we're seeing so far.
Emmanuel, you always give such excellent explanations of just the most complex questions. So I'm going to hit you with another one. Early in the pandemic, we were told that we wanted to see high vaccination rates, and we started hearing this term called herd immunity. And the initial guidance was that, you wanted to see higher vaccination rates so that you wouldn't see as much infection. Do you think that some communities were successful in achieving herd immunity while others were not?
Yeah, that's a fantastic question. One thing I will say is, the idea behind herd immunity, for those that don't know, is basically everyone is vaccinated, the virus isn't being transmitted because most people are vaccinated. The virus doesn't get a chance to get transmitted from another person to another because the immune system of certain individuals beat the virus before it transmits. However, I'm going to emphasize that, the United States, we don't live in pockets. We all travel. People have relatives all over, and even the world itself, people move around, right? But looking at the United States itself, it's really hard to single out certain communities that have reached herd immunity. So I'm just going to speak in general as a country. So the United States hasn't reached herd immunity. A lot of things affect that. And I think a huge part of that is the virulence of the new variants that we're seeing. So the virus is able to escape or even evade the immune system in some cases, and even get transmitted even in a vaccinated person. So it's quite a hard goalpost to catch because it moves every time. But then I've seen a couple of reports saying that with the rate we're going, we might reach herd immunity by 2024. So it's not all doom and gloom. There is some hope that at some point in the future, but it's not a clear goal at this point.
Okay, but at least we have some early projections that perhaps at the vaccination rates and what we're seeing, we may get there eventually.
That's right.
Okay, so I read somewhere that we are in an endemic. We've moved from pandemic to an endemic phase. Is that where we are now?
Yeah. So again, that goes back to my question, my response about the herd immunity, right? It's for the most part of the population. I think we're getting to the point where we're saying that even though there might be resurgence in cases, we're not seeing a sharp increase in hospitalizations or deaths from COVID. It's really so it's a good sign, but it's not to say that all is all great and we're all ready to go and return back to life as we were, before the pandemic. However, the signs are looking positive that it's looking like the cases are not really the severe cases are not really increasing and deaths are not increasing. So that's a good thing. But one of the things I don't want to pass across to the audience is the idea that every single one in the population is safe. Even if when we get to an endemic, there's still going to be populations of people that are likely to have severe hospitalizations from COVID or even death just by default of comorbidities, their age, and so many other factors, or even in some cases immune deficiencies. So while most people might be fine, there's still going to be a sizable amount of the population that have to be careful even moving forward with the pandemic or endemic.
That is an excellent point. I'm glad that you made that so people don't run out and think, oh, we don't have to have protections or distancing or all those any things. So what happened to the flu statistics? We've all been so busy tracking COVID. What happened to the seasonal flu?
Yeah, that's a fantastic question. And one of the great things, or one of the few positive things about the pandemic and the restrictions that happened is because people are not really interacting, most people are putting on their masks. There's been a drastic, phenomenally drastic reducing the amount of cases. Just for example, in 2020, there were about 130,000 cases of positive flu cases. In 2021, there was 1,316. So that's by folds of 1,000, right? Increase in the cases of flu. That's a great thing, but a huge part of that has to do with the fact that people were, mostly isolated. People were in their masks, and that's a huge part of it.
See, there's something great that came out of this Really difficult situation. You're right. Because people are like, the flu disappeared. I said, no, I don't think it disappeared. I just think we were more conscientious about hand washing, about, covering our faces. We did all the things that we're supposed to do. Okay, now you told me smallpox hasn't really been the resurgence as much as measles and mumps, but let's talk about monkeypox, because that's supposed to be a disease transmission from animals to humans. So can you update us on what's fact versus fiction? Because that's pretty scary.
Yeah, that's you are absolutely right. It is a very scary thing to hear another disease out there. But one thing I want to emphasize too, especially with the idea of facts versus fiction, a lot of people once they hear monkeypox, they think it's an anomaly. It's actually not. 60 to 75% of viruses that we have today actually are inoculated in other non-human species. So it's very common to see what we call a zoonotic spillover. That is, a virus moves from it might be pathogenic or it might not be pathogenic in a non-human organism, mostly human beings. It's very common. So, well, monkeypox has actually been around for a while. It is very similar to the smallpox as far as the family of the virus. So, it's typically transmitted through sexual intercourse and exchange of bodily fluids. One of the most, I guess, biggest fiction I hear about the monkeypox is that it can only be transmitted sexually. That's actually not true. Even though 98% of the cases are through sexual intercourse, there's still some cases whereby people that are living with someone who was exposed to monkeypox, and they got it from by living with such people. Nonetheless, it's really a matter of contact. It's not like the COVID that spreads to the hair. It's really something that you have to contact body fluids or be in very close proximity, close contact with an infected person.
So that's interesting because you said we talked about smallpox, and I saw in a media outlet someone asked that question. I thought it was a good question, so I'll ask you: if you've been vaccinated for smallpox, does that mean that you're protected against monkeypox?
That is a fantastic question, and that's actually a very common question. So, like I said earlier, smallpox and monkeypox are very, very similar, right? They come from the same family of viruses. So, what we've seen in evidence so far is that those that were vaccinated against smallpox actually are protected. They have some protection. The level of protection we haven't quantified yet, but we've seen that there's evidence out there that those that were vaccinated with the smallpox vaccine have some protection against the monkeypox. Some preliminary studies are saying it's about 85% effective so far. So it's a great thing because at least we have a second line of defense against this virus.
Okay, well, I'm a baby boomer, so I believe I had that vaccine then. So those of you, if you were up on your vaccines, you get that almost 85%. So we'll keep watching that. That's a promising number. Okay, you brought up a good point earlier, and I want to go back to that when you talked about because of COVID, people weren't going out. And so parents weren't keeping up with vaccines because at some point people were isolated in place and they weren't going anywhere. But there was also misinformation about vaccinations causing autism. And so some parents decided they weren't going to get their kids vaccinated. And I found this statistic in the Texas school district, which was interesting, that in 2007, they had about 10,000 children who passed out or took non-medical exemption forms to school and said, this is the reason that we're not getting vaccinated. Well, now that's 5 times higher now, where, we're looking at 5 times the families are saying because of non-medical reasons, we're not getting vaccinated. Do you think it's, again, that misinformation that people think that the vaccinations were harming their children, that they just stopped doing it?
Yeah, I think misinformation has a huge part to play. And a lot of studies have shown that, yes, we have seen that misinformation affected the choice for people to vaccinate children. But the most interesting thing about this is that it's very variable on the state level. So as a country as a whole, the rates of vaccination in high schoolers and high school school age children hasn't really changed that much as a whole, as a country. But when you go down to the state level, there's very drastic variation as far as the rates of vaccination and how those exemptions from vaccinations have increased. So I'm not gonna speculate and say what states have it, but we've seen in the case of Texas and why those states have those just differences. But we know that there's a huge amount of variation on the state level. But as a whole, as a country, there hasn't been that much of a change.
Bill, you've just published an op-ed that reminds us that even as we are contending with a war in Ukraine, even as we are contending with the potential for a recession, even as we're contending with high inflation, countries still need to, and leaders in private sector still need to make pandemic preparedness or prevention a top priority. How do we do that when there are other concerns that keep creeping into the conversation?
Well, we're certainly at risk that global health issues may get deprioritized as there's so much else going on, whether it's the ongoing pandemic or, as Peter says, however you characterize HIV, malaria, and TB, where the equity issue there is super dramatic. And it's good in a way that, when infectious diseases hit rich countries, it reminds people, wow, we're not the only ones suffering from this. What about these great tools that we have access to? When the prevalence goes down in the rich countries, that awareness tends to diminish. Now, various bilateral programs like US PEPFAR and the Multilateral Global Fund have done a good job reducing a lot of that inequity. But it'll be an interesting test. There's a replenishment that comes up probably in the last quarter where Global Fund's going to go out and ask for an increase from 14 billion to 18 billion. And we'll see in the face of all these priorities that are, I agree, absolutely important priorities, can global health maintain the visibility that it deserves? Lots of work to do on this pandemic, lots of work to do on those three diseases, and lots of work to do on those health systems. That's the front line for all the things we're talking about. And those investments, are very dramatic in terms of the payoffs you get, in terms of the human capacity you get by getting rid of these disease burdens.
Maybe I'll add one other dimension to this discussion, because public health funding is going to be an important factor here in terms of combating the future pandemic. But one of the realizations I think that people have been coming to over the last couple of years is that combating pathogens is not just a public health priority, it's also a defense priority. And I remember I had this conversation in the White House actually in March of 2020 when we were sitting around, and there was a realization that we could have been under a bioterrorist attack and been under attack for weeks, and many people were dying, and we didn't know the source, we didn't know how to combat it. And so I think there's sort of an increasing awareness that combating a pathogen is increasingly a defense priority too, that the next attack, it may be the next coronavirus or the next antimicrobial resistance, but it could be a bioterrorist weapon. And so what that brings into the equation is that we're not just necessarily looking for public health funding, which unfortunately goes through surges and then dies off, but we should be accessing defense budgets too, and those unfortunately tend to be more perennial. But we've got to remember that, again, fighting pathogens is not just a public health priority, it's a global defense priority too, increasingly going forward.
Well, let me go back to you, Bill. You're an investor, you're somebody who cares deeply about innovation. How do we incent innovators to focus on biology for the underserved market?
Well, markets work for lots of things, but markets do not work to incent investment in malaria eradication or, TB vaccination. Those are incredibly expensive things that the affected countries don't have the resources and there's no market for those things. So the term investor, if that means you're seeking profit, no, I'm not an investor. If it means trying to improve, the 300,000 kids who die every year of malaria, then yes, the metric is always going to be lives saved. And, the greatest underinvestment is still in infectious disease. As we make progress there, we will want to move up and do non-infectious disease, non-communicable disease, NCDs is the term people use. And some of those, the therapies are getting cheap enough now that they really are suitable for going global and making them available for everyone. But we still have a lot left to do on infectious disease, and the generosity of rich world governments is very important for that. For pandemics, it's different. They should fund those things even if they only care about their own lives. A insurance policy that costs a few billion that fairly often will save you trillions of dollars is a very, very good deal. So we shouldn't take the budgets of the, helping out developing countries and divert that for pandemic. Pandemic money should come from health spending, or just however you think of protecting your citizens, while we continue a high level of generosity for the unique conditions in developing countries.
Peter, you look like you want to get in here. Your body language is...
I just wanted to agree with that point, which was that if better pandemic preparedness for the world as a whole is at the expense of the lives of the people in the poorest communities, that's not a great outcome.
Okay, well, you know what? On my show, I always give my guest the last word. And Dr. Ayanjoki, you always have a positive last word for us. So when people try to look back on this show and say, what's going on? What are you going to tell us is going on here?
Yeah, I think I can always only end with this. There's a lot of information out there. At the end of the day, I think what everyone should seek to do is speak to their local healthcare professionals. They have your back. They take care of you like family. They know everything. They do their best to serve you, right? So reading a random post or YouTube video, watching a YouTube video about something you heard somewhere, don't make a final judgment based on those things you see. Speak to your healthcare professionals, and they will tell you the nuances, right? Some things that sound true and sound very logical will be far from the truth. So always speak to your healthcare professional, take common sense procedures to be safe, eat healthy as always, and just, do whatever you can to live a very fruitful life.
Well, you know what? I want to say thank you for coming on Tap Talks to my favorite pharmacist in the whole world.
Thank you.
Nodum, you and Nodum. And you always you always answer to the call. And I just want to thank you for coming on Tap Talks. You guys are amazing.
I'm always happy to get. Thank you.
All right.